little bit about your symptoms and how they started and when they started.
I've been having blood clots, DVTs, deep vein thrombosis is the big $5 word, since about 93 or 95. It's been ongoing. It has slowly progressed to the point to where I was forced to retire. The leg would swell so much. I was a police officer for just shy of 15 years. It would swell so much that it would rip my uniform breeches. There was a leg ulcer that formed, and that was for rubbing on the top of my boots. My leg would swell so much. I was a scout leader also. We would do overnight stays at the Red Stadium with the boys. When I would do that, go to the game, stay overnight, we would have to vacate the stadium about 7:30 in the morning. I would be toast the next day. I'd have to stay in bed. My leg would swell so much, and there was so much pain. I've been to most doctors in the Cincinnati, Dayton, and Columbus area.
What did they say was wrong and could be done for you?
Well, every doctor I went to said, yes, we can fix this. The doctors I did see would throw medicine at me, narcotics, everything else. Tried the new stuff that's out on the market to help. Unfortunately, that didn't work. In fact, it made things worse to the point where I've lost my teeth. My gums have receded. They practically fell out. I've been to the Cleveland Clinic. They've successfully helped me reduce the leg ulcer to the size of a soda can down to about a 50-cent piece. And that's where it's maintained and stayed until I came through the door here.
So how did you find Dayton Interventional Radiology? How did you find out about them and what they do?
Well, I've called around. You see on commercials on TV, we fix varicose veins, spiders, veins, everything else. To back up a little bit, I saw on Channel 7 News, Dr. Goldstein out of Mount Sinai Hospital used a angiojet to go through and clean out blood clots out of the legs. My thought is, that's exactly what I have. That's what I need. I call around to these places and they say, no, we don't do that. We don't have that. We don't offer that. Back when I had, in December of last year, 2009, after I had my teeth removed, developed blood clots that went into the lungs. I found an intern and discussed to him. He's like, they do this. I'm like, who? Where? And it was like he had to get an act of Congress to get a phone number. Basically, everything in the pamphlet that they offer described everything I was having. I mean, from the leg ulcer, this leg ulcer that they show is minimal compared to what I had. He discussed that he can go in with the angiojet, go through, look and see what's there to vacate those blood clots. And he said that we can do it, set up a surgery. Well, it wasn't in the time frame I was looking for and needed, and got it moved up.
And they were willing to work with you on that and they moved it up for you?
Oh yeah, the girls in the office are great. I mean, my leg was swollen so bad, it was to the point where I couldn't sit, I couldn't walk. I was literally in bed in tears.
So how was the procedure explained to you, that what would be done for you?
On the angiojet, they were going to go in the vein behind the knee, and from there they can access most of the veins in the leg. So there will be a small spray of an anticoagulant. I couldn't tell you which one it would be. Basically, it would sit there and dissolve it from the walls and loosen it a little bit, and then they vacuum it out. A rotor-reader job. And there's no pain, no nothing. You feel discomfort when they first enter. Not pain, just discomfort. And occasionally you feel them rooting around in there, but no pain. But the Band-Aid I removed was just a small circular Band-Aid.
What kind of restrictions were you on after the procedure?
First 24 hours bed rest, first 48 hours no driving of a vehicle, and limit yourself to your pain tolerance There was no narcotics needed, no nothing for this procedure, just Tylenol. It's done right there in the office. Recovery's there, it's a short time. It's considered outpatient surgery.
No overnight stays?
No overnight stays, thank God. After the 48 hours, you're encouraged to get up and walk. And I can see why, because it stiffens up. It feels like kind of like a pulled hamstring.
So what limitations have you had from having these procedures done? Is there anything you're not allowed to do now since you've had these done?
Only within the first 24, 48 hours of a procedure.
And in the last year, you've seen a massive increase in your abilities to do.
Oh yeah. I'm almost, after he opened up the abdomen with the stents and cleared out most of the blood clots that he can get to, the reduce in swelling has been 60% downsize, and it was noticeable within the first hour after the procedure was done.
So how has the ulcer changed over this time? Because I know that was one of the big problems that you had, was this thing was there for years and wouldn't heal and wouldn't heal and wouldn't heal. How has that changed?
It's slowly changing. I'm still in the middle of procedures. I got a couple more to go through. It has gone from the size of a little bit bigger than a quarter down to maybe a nickel within maybe 3-4 months.
How has your life been changed now that you've had this surgery and it's been successful?
I'm not 100%. Am I able to return back to the work field? Most definitely not. I was able to take my son trick-or-treating. I was not able to walk that long of a distance prior to. I'm grateful I got a 5-year-old. I'm the sole parent, so I'm all he's got. Being able to take care of him, watch him grow, that would have just devastated me. Because of these doctors, I'm able to do that. I'm able to share this.